10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hi and welcome. I'm Alex Sampson with Health Benefits Associates. I'm here today with Grant Dodge, another coworker of mine.
Good afternoon, everyone.
Yeah.
Welcome.
And this is our episode of Mastering Medicare. So this is going to make you an expert, just like us, on different Medicare plans and what's going on. As always, we definitely want you to reach out to one of us in case you need some advice on your specific situation. We're always here. We are here in Northern Nevada. We have offices here in Reno, Sparks, and in the Carson Valley, here to help you out. So before I get any further, I want to let you know today is actually a really special day. It is October 15th. So today is the beginning of the Medicare annual enrollment period. And this is a unique time of year when you can switch certain Medicare plans, and we're going to talk about that a little bit today. You can switch certain Medicare plans without any health questions. You can switch right over, and any changes you make will be effective on January 1st. And so today the subject of this particular presentation is going to be Medicare Supplement versus Medicare Advantage. And we've actually been getting a lot of questions on this recently because it really depends on which plan you're on, and that will determine a lot about if this Medicare annual enrollment period even applies to you or how it works. And so I'm going to go through a couple of questions that we've kind of come up for. And Grant is actually going to be the Medicare Advantage person. I am going to be the Medicare Supplement person. And we'll go through and I'll answer questions about how these affect Medicare Supplement. And Grant is going to go through how these affect a Medicare Advantage plan.
And keep in mind, Alex, one thing I want to just chime in real quick. We have people on both Medicare Supplement and Medicare Advantage. We help people on all of these different options. And it's not always necessarily the right choice just for everybody. Different types of plans apply to different types of people. So keep in mind that this is something that we can help with regardless of your situation. We can help you find the right choice.
That's a great point. I always get the question of which one's the best one to go with. And there is no one size fits all for these things. Everybody's situation is unique. Different people go to different doctors, take different prescriptions, live in different parts of the country. I mean, the situations are endless. So what might be important to you might not be important to the neighbor who recommended a certain plan to you. So it's good to get somebody you can talk to, who knows all the different insurance plans that are here in Northern Nevada, who's licensed with all the different companies here. So enough about that. We'll get right into it right now. So number one, if you're on a Medicare Advantage plan, the Part D plan, do you get a separate Part D or is Part D included? How does that work with Medicare Advantage, Grant?
Yes, that's a great question, Alex. This is something that comes up all the time, especially for people that are just transitioning into Medicare or have always had some sort of separate Part D drug coverage. But in a nutshell, if you have a Medicare Advantage plan, most of the time your Part D drug coverage will be built right into the policy. So you don't actually sign up for some other sort of Medicare Part D drug plan. You would already have drug coverage built right in, and that is all you need. On a Medicare Advantage plan, in fact, if you sign up for a separate Part D drug plan, a lot of the time that will automatically terminate your current Medicare Advantage plan. That means now you would lose your doctors, you would not have any extra benefits, you'd lose medical coverage in general. So that is something that's really important to discuss with somebody in our office that says, okay, I have a Medicare Advantage plan today. Do I need to sign up for this sort of extra Part D drug coverage? Most of the time, if you have a Medicare Advantage plan, the answer is no.
Right. And for Medicare Supplement, it's almost the exact opposite. So Medicare Supplement plans, it's very rare to see them include drug coverage anymore. We aren't selling those plans anymore. Those plans aren't available even anymore. And so we don't really see a lot of people on those. Instead, almost everybody has a separate Part D prescription drug plan. And it doesn't matter what supplement you're on. So you could be on a supplement plan F, plan G, plan N. Usually you have that separate Part D prescription drug plan. And most people know it because they're paying a separate premium for it. And so now during the annual enrollment period is the time to switch that Part D prescription drug plan. But without me spoiling anything further, it is not the time to switch a Medicare Supplement plan. And we'll get into that in just a minute here. So that segues nicely into our next question. So the ability to change. So right now, obviously October 1st, beginning of the annual enrollment period. Tell me how a Medicare Advantage plan, how would I change a Medicare Advantage plan if I was on one today?
Yeah, so now is that time of year to do that freely. You can make unlimited choices towards Medicare Advantage plans during the annual enrollment period. That ends on December 7th. So if you want to shop around and look at other options, now is the time to do it. Now is the time to pick up the phone and figure out what those options are. That is something that we would certainly help you out with, is comparing those different choices to what you have today. Medicare Advantage plans, you can switch anytime during this month and a half or 2 month and a half window. If you have one Medicare Advantage carrier and you're interested in other options, you can discover which doctors are covered under that other option. You can figure out what extra benefits are included in the plan and see how your drugs are covered and whether or not this might be a good fit for you. Every year, these plans change. New benefits, new choices, new doctors. So it is important that if you haven't had a refresher for a while, to certainly look into that.
Definitely.
But for a Medicare Advantage plan, remember this is something completely different from a sup. How would you, during on a supplemental plan, go forward during this Medicare annual enrollment period?
Yeah, and so really during this annual enrollment period, this only applies to your drug plan. And so as I mentioned a little bit before, you can change the drug plan now, but there is no annual enrollment period for Medicare supplement plans. And I think that that cannot be understated. I have a lot of people call in that say, now's the time to switch my supplement. If you want to switch a supplement, we can do it any time of year. We can do it by passing health questions. Unfortunately, they can deny you a new supplement plan if you can't pass the health questions. And so that's an important thing that I think most people don't realize, is if they got onto that supplement when they turned 65 or when they first elected Medicare Part B, they didn't have to answer any health questions getting in the door. But in order to switch plans, you do. Beginning January of 2022, the next following birthday you have, there's a new rule in Nevada that allows you to switch right around your birthday starting in 2022. Unfortunately, for our people with December birthdays, they cannot switch coming up here this December. A lot of people have already asked me if they can switch their Medicare supplement without health questions this upcoming December. So this enrollment period, this new enrollment period that's around your birthday, we call this the birthday rule. And it allows you to switch your Medicare supplement plan for the first time in Nevada right around your birthday. And so this is something we expect a lot of people to take advantage of. I already have a list of clients that I'm going to be reaching out to who are interested in taking advantage of this birthday rule, because they've been on that supplement for years and years and years. They've seen that premium increase and increase, and they like their plan, but they know that they need a different plan. They need to shop around, and they haven't for years because this rule hasn't been out there before.
It's almost like your own personal annual enrollment period.
That's it. That's it. So being able to switch and being able to time it correctly, I think, is the most important. And that's why people are reaching out to us now rather than later, because they know that we reach out to them timely and that we get everything into the insurance companies on time so we can switch their plans. Now the next question, counting down to number 3 here, the cost to the member. So tell me, on Medicare Advantage plans, what costs are we seeing per month and what costs are we seeing going into the doctor?
Yeah, so that is something that a lot of people that are new to Medicare Advantage are surprised to hear about, the cost for Medicare Advantage. Most of that often is $0. So this means I am not paying anything extra to be enrolled under a Medicare Advantage plan. Now, there are certainly many different choices that are out there, but there are plenty of insurance carriers that offer a $0 Medicare Advantage plan, so no cost. That means if you have a monthly premium for a supplemental plan as well as Part D drug coverage, because remember that is included in the Medicare Advantage plan, if you're paying per month, those costs are now going away. Now, next question is, how much does it cost to go to the doctor? That's another good question to certainly get an understanding of before you sign up. But typically, a lot of the doctor visits that we're seeing on other choices can be as low as 0. It certainly depends on the plan, and every plan is different as far as the level of coverage goes for how much they cover doctor visits, but it will be different per visit. So copay for a doctor visit will be different than a copay for a specialist or a hospital or surgery or an ER.
Just going over that a little further, we are restricted a little bit by CMS. So the reason that Grant's kind of skirting around specifically mentioning certain plans is because
we can't specifically discuss plan benefits unless we have met with you as the Medicare beneficiary and completed what's called a scope of appointment form so that we can discuss how these benefits work. These are rules that the federal government and the Center of Medicare Service has put in place to help protect you as a beneficiary so that you know exactly what you're talking about when you come in and see us.
Yeah, and we like to keep things just right buttoned down in our office just to make sure that you have everything you need. We can do it in a very compliant way that's still friendly for our members and for everyone involved. But anyhow, back to my part of the answer here. The cost to the member on a Medicare Supplement plan. So this, again, depends on the type of Medicare Supplement plan you have. So if you have a plan F versus a plan G versus a plan N, so those are the three most common plans that are out there. With a plan F, that doesn't have any cost to the member when you go in and use the medical services. However, the plan Fs tend to be the most expensive premium on a Medicare Supplement. So the plan Fs, a lot of people are seeing that price increase and increase and increase. As you may know, they don't sell the Medicare Supplement Plan F anymore. And so now we're seeing the prices dramatically increase. And so that's why we have so many people approaching me talking about the birthday rule. Or now we've had more people switch over to a Medicare Advantage plan this year than ever before, because we are really seeing people on that plan F discover, you know what, I want extra dental benefits included, or I want these additional benefits that maybe aren't on a Medicare Supplement plan. Well, I know that Medicare Advantage plan has it, I'm going to go for it. So not saying that a Medicare Advantage plan is right for everybody. Again, at the very beginning, every different person is unique in their own way here. So the plan G, which is the next most popular plan, has a small Part B deductible. And so don't get into too much of the jargon here, but you have a small deductible on the next most popular plan that's out there. And the plans go down from there as far as they add additional costs when you go in and see the doctor and get services. Now, most of the time we can recognize somebody with a Medicare Supplement right away on the phone because they're telling us they're paying $200, $300, sometimes ridiculous amounts here every single month just to have their supplement in place. And then they're paying again to have their Part D prescription drug plan in place. Now, just to be clear, on both options, you need to continue to pay your Medicare Part B. And so that goes to that goes to Medicare. Usually for most people, that is taken out of their Social Security automatically every month. There are plans out there that reimburse that Part B deductible. We get questions about that all the time. Do you want to answer a little bit of that?
Yeah, some of those plans are really designed more towards specific veterans or other people in certain demographics. A lot of the time, too, we see that a Part B reimbursement plan may give you some money back for that coverage for Part B, but it may take out other benefits in other areas of the policy that you could end up spending more money on. So once again, it's always great to compare those options and to just go over how exactly the pros and cons are and what you're getting and what you're certainly giving up as well.
Yeah. When we have our offices open here in Reno, we really need to stay impartial to these and really do what's best for our clients. So instead of having some call center, having somebody over the phone who maybe won't even have the same phone number in 6 months to a year, we want to make sure that our clients are on the right plans because our front door stays unlocked 12 months out of the year. And anytime they have a problem, they just walk right into our front door. And so we're more interested in making sure that they're on the right plan than we are on any other factor that's out there.
Alex, I can't tell you how many times I've heard somebody call our office and say, oh, I signed up with some 1-800 number on the TV. I can't stand my plan. It's not working for me. It doesn't cover any of my doctors. And now I can't get a hold of them. Yeah. What do I do? It happens all the time. Doesn't happen here, though, because you know who you're talking to. We discuss, go over all those options for you, make sure you understand exactly what you're doing.
Yeah. I'm going to plow through here. So reimbursement to doctors. So how does a Medicare Advantage plan, really not too many of the details, but how much is a Medicare Advantage plan reimburse doctors, or are doctors paid better on a Medicare Advantage plan?
It certainly varies on how much doctors are reimbursed from Medicare Advantage plans, but a lot of what we hear and how it works is called value-based care. These are Medicare Advantage plans that are reimbursing doctors based on how well you are following up on your routine medical services and keeping up with your health. Doctors are reimbursed more the better you're taking care of these services. So it certainly differs from reimbursement with a Medicare Supplement plan.
Yeah, and the Medicare Supplement plan, a contrast to that, is more about fee for service. Think of it like every time you go in, you get that, the doctor gets that fee for seeing you. So that's the traditional type of, you use the service, the doctor gets paid. And so it does differ, and there are doctors that prefer one over the other or the other over one. There, we don't see anyone that, the majority of doctors are favoring this versus that. I get them all the time that say one over the other. So that can be a factor, though, if you're looking at plans. I do see overall more people in rural counties on Medicare Supplement plans and more people in more populated counties on Medicare Advantage plans, but not to say that works for everybody, but that's just a trend.
Yeah.
Finally, and this kind of segues into the next one, number one here, access to doctors. So on a Medicare Advantage plan, how is the access to doctors? Can I go to any doctor anywhere?
No, you can't, Alex. And that Medicare Advantage carrier most of the time will have very specific doctors that you can use when you use the plan. So you need to stay within the network so that you are paying the least amount for those doctors. There are some plans that include national list of doctors or say that they cover any doctor even out of the network, but most of the time, even in those types of scenarios, you're going to spend more money for those services, much more than you would if you stayed in network. Right. Now, that being said, a lot of the doctors that are in network for these Medicare Advantage plans, you are getting priority access to. So you might be able to get in and schedule an appointment much sooner than somebody that has another type of insurance, such as a Medicare Supplement plan. In addition to that, a lot of Medicare Advantage carriers will have specific clinics just for their members. These are clinics that you might be able to get in and see somebody within 48 hours, or maybe even walk in same day. Maybe your current doctor is a little bit too busy, can't make an appointment. We all know that this is something that's been a problem here in Northern Nevada for quite a while. We just don't have enough doctors, so this is a huge advantage for somebody that is on a Medicare Advantage plan.
Yeah, right. And so the Medicare Supplement plans, now the doctors on a Medicare Supplement plan are supposed to be any doctor nationwide that takes Medicare. However, what we've seen lately is that some doctors just are not accepting any new Medicare patients, and that can be a problem. Also, doctors are just, when they're out there and they're accepting these patients, some of these doctors are tied in with certain hospital groups, and it's really tough for them to actually go outside of whatever they're given with this Medicare Supplement plan. Now, you're not seeing that different Medicare Supplement plans from different insurance companies cover a different doctor's list. So let me say that again. If you have a Medicare Supplement from one insurance company and you look at a Medicare Supplement from another insurance company, the doctor's list will be equal across both of them. It's going to be any doctor that takes Medicare. And so that cannot be understated here. It's usually a bit better for people that are spending multiple times in multiple locations. However, even now, it's surprising to see different Medicare Advantage plans coming up and covering nationwide list of doctors on certain plans. And so I think a lot of people are saying, well, I'm on a supplement today because I travel a lot. Mm-hmm. And I'm thinking, well, you know, how relevant is it? Are you just going and using it when you're in an emergency outside the state? Or are you spending 6 months in a home that's across the country? Those are a little bit different scenarios. So it is something that is kind of fluid, and we see this doctor problem all the time with doctors not accepting new Medicare Supplement patients or different Medicare Advantage plans. You know, it's good to check and make sure that the doctors that you need, number one, are going to be covered by the plan right now during this annual enrollment period. So right now, I've actually got a bonus question, my last one, and then we're going to move on to our little short quiz here. we're looking at extra benefits here. So a lot of people, I've got questions about it. They say, listen, I love my Medicare Supplement plan, but I need extra benefits. And I heard there's a plan out there with no monthly costs that has dental and vision and hearing aids and everything else I want included. What do you do?
Yeah, the rumor's true. There are certainly plans out there that don't have any monthly expenses that include extra benefits, dental, vision, hearing, and over-the-counter allowance, gym benefits, all sorts of extra stuff that is normally not included in a Medicare supplement policy. So to do, or what do you do if you want a plan like that? Let's talk to you, shop around, and see if there is a plan that, one, covers your dentist or your favorite vision provider or your gym, one that offers extra, more better benefits for extra benefits than another option that's out there.
Yeah.
A lot of these plans are included right in the policy, so they're great choices and certainly a huge pro and huge reason why a lot of people choose Medicare Advantage.
Yeah.
Do supplemental plans, Alex, include these types of extra benefits?
Now some of these supplements, you can buy these additional benefits for an additional premium. Other supplements include discounts for vision or discounts for dental services. That's usually okay. The benefits aren't going to be as rich as they are with the Medicare Advantage plan, but you can always purchase these separately, and a lot of people find that what they're getting with the Medicare supplement is not worth giving up to try to get an increased dental benefit or an increased vision benefit. They really think it's more important that their specialist is covered or that they have certain benefits outside the state. So without any further break here, I'm going to go right into this little Q&A video.
You're now entering another dimension. A dimension of choices. Choices that need navigating. Choices that will lead you to the Medicare zone.
James is insured with a Medicare Supplement Plan F and a good Part D prescription drug plan. When he purchased his Medicare Supplement, he was told that it was the best plan available, and he shops his prescription drug plan each year at mymedicare.gov. James is comfortable ignoring the annual open enrollment period because he knows his Medicare Supplement plan automatically renews each year. Each fall, James sees a lot of ads for different Medicare Advantage plans. Recently, James was told that if he switches to a Medicare Advantage plan, he would not be able to automatically re-enroll with his original Medicare Supplement Plan F. Should James shop around during the annual open enrollment period? 1. Yes. If James is happy with his Medicare supplement, he should ignore Medicare Advantage ads and continue to shop the Part D plan at mymedicare.gov. 2. No. If James switches to a Medicare Advantage plan, he will not be able to go back to his Medicare supplement plan without answering specific health questions correctly. 3. Yes, James should have a good idea of the additional benefits that Medicare Advantage plans are offering, as well as shop his Part D prescription drug plan each year. 4. Yes, James should see if his preferred hospital and all of his doctors are included on any of the Medicare Advantage plans.
All right, so our guy James, Alex, he has a Plan F. It's the Medicare annual enrollment period. What should James do?
So I would definitely not advise just walking right by it. And so doubt, yes, is the correct answer. I would say that now is the time to shop, to look at those plans. And so even if he's not interested in switching to a Medicare Advantage, it's always good just to know what's out there. And so this is the only time to look at those Medicare Advantage plans and to see if you want to drop the supplement and move to a Medicare Advantage. Also, right now he's on a Plan F. Now Plan F, as I mentioned earlier, is no longer offered for newly eligible individuals. Now, a lot of people walk right by that and say, that doesn't matter for me because I'm currently on a Plan F, so I'm grandfathered in. That's true. You are grandfathered in. However, the insurance company, instead of now just increasing the rate slowly, they don't have any new people on that plan. So that rate is going to increase by leaps and bounds now. So if you're not going to switch over to a Medicare Advantage plan, that's okay. I would recommend reaching out to us sooner rather than later though, because this birthday rule could be the next best thing to get you over to a Medicare Supplement plan without having to answer health questions beginning in your birthday month of 2022. So I would definitely, no matter what position you're in, if you're in that, you're on a Plan F, you're on a Part D prescription drug plan, excuse me, you'll definitely want to reach out to us so we can get started with the process sooner rather than later.
Great. So I guess we're going to get into some questions now.
Right.
Alice Gray had given me a shout out. Thanks so much, Alice. This is kind of the long-standing relationship we have with our clients. Every year we're shopping these plans. We're talking to our clients all year long, helping them with problems. So we love to see that sort of support.
Yeah. And I had a question from Jimmy. What's the point of switching? So what's the point of switching over from MedSup to a Med Advantage, or from one Med Advantage to another Med Advantage? So from switching MedSup plans, number one, and I think he specifically asked, what's the point of switching MedSup if you're not paying for anything per month? You're not paying when you go in to the doctor to use the services. So that could not be more important. The monthly cost on a Medicare Supplement plan goes up every single year. For some people, it goes up twice a year. And so if you're on a supplement, a lot of people that have been on a supplement 6, 8, 10 years might be paying twice what they paid when they originally signed up for that supplement. And so without the ability to shop around here in Nevada prior to January of this upcoming year, really you're at the insurance company's mercy here. When they start increasing that rate, you're just kind of a little bit along for the ride. Now, we've been recommending companies with stable rate increases, with a history of stable rate increases, so that people on Medicare Supplement plans are not going for some kind of roller coaster ride with their premium. But overall, Medicare Supplement plans are significantly more expensive than Medicare Advantage plans per month in the monthly premium. So that's the difference here. You're paying a higher monthly premium, lower cost when you go to the doctor in general. On a supplement, on an Advantage plan, a lot of them have no monthly premium, but then you do have co-pays when you go in and use a medical service. I hope that answered that question. If it didn't, give us a shout out and we'll make sure to get that answered. Lin Yu, what plans do we represent? I'll let you answer that one.
All of them. Yeah, every single one. Doesn't matter. Every Medicare carrier that operates here in Nevada, we have contracts with to show you and sign you up for. So really at the end of the day, it doesn't make a difference to us which carrier is one that we might preference. We certainly don't have that here. It really comes down to which one is best for your situation, which one covers your doctors, your meds, satisfies your concerns that you have about your insurance in the short term and the long term. Doesn't matter to us, all of them, we have access to all of them, and that's our most important thing that we value here, is finding the right plan for you.
Yeah, on the Medicare Supplement side as well, we have access to those carriers, and we want to make sure that we're not only working with the most competitively priced one, but also the one that is easiest to work with. As I mentioned, Medicare Supplement plans, it's regardless which plan you choose, all plans have the same doctor's list. So what are the differences between them? Well, number one, how much do they cost per month? And number two, how easy are they to work with? If they're a company that just denies claims, deny, we get that feedback from our clients, and we let new clients know about that. Now, we haven't had that feedback for a couple of years now. We have a lot of clients, but it is good to kind of see and get that feedback from everybody about the plans. And truth be told, when we have clients on Medicare, we hardly hear from them throughout the year because they are really happy with their plans. They're really satisfied with what we do here, and so it's always good to see.
Yeah, it is rare to hear things, but things certainly happen. Insurance companies aren't perfect at everything they do, certainly not. So that's why we're here to help alleviate those problems. You offload those on us, we help you fix them.
Yeah. So I'm going to wrap it up for today. I can't thank you enough for tuning in. Again, I'm Alex Sampson.
And I'm Grant Dodge.
Yeah. And we can't thank you enough for attending. Thank you for leaving your comments below and asking the questions. Reach out to us. There are other team members in our offices here. They can definitely help you out. They're just as knowledgeable as we are on Medicare Advantage. And please tune into our next episode of Mastering Medicare. We're going to be answering your questions live on YouTube Live, just like this. We can't wait to see you there. Thank you so much.